Hello everyone, my name is Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel, click our notification bell.
Good morning, everyone. My name is Denise Ejo, the CEO of Cornwall Cancer Foundation. I'd like to welcome you all to this forum where we talk about cancer. We are very realistic. Cancer is real. It's not going anywhere. And for some of us, we live with it. Some of us, we've gone through the sickness, and some of us are going through it at the minute. This is an opportunity where we try as much as possible to answer questions, talk about our experiences, share what we think are good practices, and people are also free to be able to explain their own views on how they felt or how the journey has been. I want to welcome you all this morning to our edition of the specialist panel. And on our specialist panel, we do have four very, very, very powerful ladies. I'm very grateful that I've had an opportunity to be with them and to join hands with them and get to know a bit more about the medical journey of cancer patients from their perspective. So today I'd like to start by introducing each and every one of them, and I'm going to go one at a time and in no particular order. They're going to briefly give us an introduction of who they are and what they do in their field very quickly. So the first person I have on is, let me pick everybody randomly. So, sorry, Doing, you happen to be the first person. So is your mic off?
Yes.
Doing is a consultant and a psychiatric consultant working in Lambeth Hospital in London. She's qualified as a doctor, which she did in Lagos, Nigeria, and has worked in the psychiatry department for over 25 years. Her specialist interests are in addiction. Doing, welcome to the panel.
Thank you.
Thank you very much for taking your time out to be with us and for being happy to share with us and answer as many questions as we have on the mental health of cancer patients this morning. As I said, in no particular order, the next person is I call her my Aburu. Biola, no, let me be very professional. Her name is Abiola Ebenezer. She's a qualified pharmacist, been working within oncology and hematology for over 6 years in the NHS, and is currently working with an HCA Healthcare as the specialist oncology pharmacist. So Abiola, thank you very much for joining us this morning. We appreciate you, and I know today I'm not working, I hope, please.
No, I'm not working.
Our resident doctor in the house, Dr. Ebun. She's our resident doctor, so please. Dr. Ebun. I trust Ebun is the one that you will never see her picture. You can see her own background is always dark, always. There's no way we can get past it.
I can make it.
Ebun is currently an associate specialist doctor in palliative care medicine. She holds a PhD in end-of-life care from the University in the Netherlands. Palliative care for her is something that she has found very interesting. And to be honest with you, I spend a lot of time chatting with her. So I'm trying to work. She has authored several books, including Healthy Living, Rhetorics and Reality, God's Champions, Beyond Measure, and Living Well, Devotional for patients, carers, and their families. Ebun supports patients with difficult symptoms regardless of their age, diagnosis, or settings, at home, hospice, or in a hospital. She is a patient advocate and the CEO of Palliative Partners, also an NGO. We welcome you, Ebun. Thank you for being with us this morning. Thank you for taking your time out. And my one and only Dr. Ella, I told you now, Dr. Ella is on the ground. For those of us that are out of the country, Dr. Ella is a consultant clinical oncologist, and she practices in our home base, which is where is important for all of us, National Hospital Abuja. She is passionate about cancer care research and advocacy. In her practice, she aims to improve cancer care in Nigeria to effectively increase survival among patients living with cancer. So can you all join me in welcoming up speakers for today? The floor is going to be predominantly open to any questions, anybody that has things to say. But before we do that, I'd like them to briefly tell us how they work within the space in which we're talking about, and their support for cancer care nationally. So who wants to start? Resident doctor, start. Sorry, I've nicknamed her Resident Doctor for those of you who don't know, because she's the one that gets the heat every other week that we run our cancer, and she's always the Resident Doctor in the house. So everybody goes after her. And if we do this, and if this happens, and what happens here? So today we've got Ebun. Can you introduce yourself and tell us a bit more about the kind of service provision you give to us as cancer carers within the community?
Okay, Denise, thank you very much. I know I've been on every session, but I don't take it for granted. Thank you for this initiative, and well done, well done, well done. Hello everyone again. I'm Ebon, and somehow I found myself in palliative care on one of our sojourns when we were traveling, doing other things, basically, and it coincided with when my mom was diagnosed with cancer. So it was it kind of was complementary. Her treatment was complementary to my training, as it were. And I found a lot of fulfillment in doing what I do. Palliative care historically was care for patients usually with cancer and patients that were terminally ill. But over the years, the specialty has evolved, and we do manage patients with different diagnoses, even though we manage primarily patients with cancer diagnosis. We manage patients throughout the course of their illness. We manage patients that are being actively treated or receiving systemic treatment, whether it's chemotherapy, radiotherapy, that have physical, psychological, and other forms of symptoms. So one of the things we do is pain, but then we deal with difficult nausea, vomiting, and then depending on where the cancer is, you might have disease-specific symptoms, seizures, and so on. And I think that should be okay. Something else that I think I should mention is that we also look out for the significant others, which could be family members, could be neighbors, could be the patient's pets. For some people, it's their dog, it's their cat, and any other person or persons that is important to that person. We are very anticipatory in our planning, so we are thinking about the now. We are also thinking about, the later, which sometimes forces us to broach very difficult conversations, which can be quite challenging. But we try to support people so that even if they are not here, their loved ones are able to manage. Research has shown that when certain conversations are held, and if possible packed somewhere, people manage better, and even bereavement is kind of easier to put closure to things. So I'll stop for now, and then maybe later on I'll talk about other things that we do. Thank you.
Thank you, Dr. Ebun. Doki in the house. Thank you very much.
Thank you.
For you. Thank you. The next person I'm going to call on is Dr. Wachuku. Okay, let me call her the way I call her, Dr. Ella. Dr. Ella's device may not. Dr. Ella, can you put your? I just saw you just now. No.
Yeah, my video is on.
Yes, okay, I can see you. Okay, Dr. Ella is next. And just so you know, Dr. Ella, before we go very far, 2 of your patients have come online and said, "Oh, I know her." Thank you. You see how this world is. I know Dr. Ella. So that's interesting. Dr. Ella, we're introducing you. Can you talk about what you do? Dr. Ella is based in Nigeria, working in the National Hospital with the Cancer team. Free,
Yes, so,
carry go. Don't worry,
okay.
I have fun on this platform. It's happiness. Our platform is happiness platform.
Good afternoon, everyone. My
Good
name is
afternoon.
Dr. Ella Wachuku. I am a clinical oncologist, which means I manage patients living with cancer using chemotherapy and radiotherapy. I work at the National Hospital in Abuja. I did my training at the National Hospital too, but I have a fellowship at the West African College of Surgeons in the radiotherapy subspecialty. And it's been, I think I started in 2007, so it's been 13 years in this field, and I get my fulfillment from, caring for patients. I'm very, very passionate about patient care. I want all my patients to get the best. But which is always a challenge in Nigeria because of, a lot of financial constraints, and then also availability of standard guidelines. We don't have most of the drugs that are readily available in other parts of the world. They're not readily available here. And even when we try to source for them, they cost an arm and a leg. So we do our best to give our patients better survivals. We want people to live longer. And even when we don't, we go into a lot of palliative care too. We don't really, it's growing. Palliative care is growing in Nigeria. But at the end of the day, most oncologists have to play dual roles by being, an oncologist and also a palliative care, physician, and even the psycho-oncology. We don't have psycho-oncology, so you play multiple roles in one. But we make do, and I'm happy to be here today. Thank you for the invitation. That'll be all for now.
Thank you, Doc. Thank you. Really appreciate you. So now we've met Dr. Ella. Next, I'm looking at them first, so it's his first name in front of me. Biola. Sorry, I cannot go this way. Please, Biola, yeah, go on, carry go.
Good afternoon, everyone. I'm Biola Ebenezer, and as Auntie said, I'm a pharmacist. I started off in oncology and hematology around about 2014 or 15 as a Band 7 specialist oncology pharmacist in the NHS. I worked there for about 4 or 5 years. Basically, my job role is to look after the drug side of chemotherapy. So screening the prescriptions, screening the everything, the TTOs, that basically the things, the supportive medication, counseling the patients on how to take their drugs, what to expect during their treatment, how to deal with any side effects, answering any questions they may have with regards to their treatment. For the last 2 years, I have been working at Great Ormond Street. I've only just moved to HCA in the last 3 weeks, actually, back to being a specialist oncology pharmacist. But before then, I was at Great Ormond Street Hospital working with the parenteral nutrition team. though I was working with hematology and oncology patients, but dealing with their nutrition side. So basically liaising with dietitians and the doctors to ensure that, whilst the children are undergoing chemotherapy and they are suffering from things like, mucositis and unable to eat, they have adequate nutrition, so their IV nutrition. So now I'm back at HCA in oncology. Just basically my job role there is to, again, check the right prescriptions are done, the right treatment is given to the patient, the doses are okay, check for any reasons to change their doses, or if they're going through any side effects that need a review by the doctor. We look at that, and we also counsel the patients, basically talk to them about nausea, vomiting, diarrhea, constipation, all the side effects that are expected from their treatment and how they can deal with those. So that is what I do. Thank you.
Thank you, Biola. Thank you. You're welcome onto this platform. Anyway, you are also one of our resident people. Whenever you can find space, so I want to say thank you for taking your time out to be with us today. Last but not the least, Dr. Doi, yeah, next.
Hey, thanks for the invite. It's a wonderful opportunity to be able to share with everyone. In my role, probably limited, most of the contacts I've had with cancer patients over the years has probably been in a secondary role. I probably wouldn't see a lot of cancer patients as me being their first contact in the medical services, apart from my immediate patients. But we do get a lot of referrals, say from GPs or patients that are already on the wards in the hospital, that there are concerns about them. Either they've just been given a diagnosis or just been given a bad prognosis. They tend to, when their moods change, they then get referred to the psychiatric services, and then we would step in and assess them and decide whether what sort of treatment they would require, either medication or counseling, basic counseling, or whether they need some further, more developed specialist psychological, treatment. So that would be our role as psychiatrists, mainly to treat depression, anxiety, and of course, if a patient becomes suicidal, then they would get referred to a psychiatrist. So in a secondary role, usually.
Thank you, Doi. I knew you were going to do sharp. I just knew. The fastest way out for doing. So first things first. Let's set out our rules very quickly, because we're not very complex on our rules. Everybody's allowed to ask questions. Everybody, just let me know, and you'll put your questions up. If you have any questions, send them to the box, and I can either read it out or put up your hand and you can ask your question direct. We have a panelist of professionals, as you see. They know what they're talking about, so it's left for us to ask them directly. If you are free, because I know this is quite sensitive for a lot of us, to close your camera so that you can actually speak. Just put up your hand and let us know that you have a question, and we can go from there. So I'm going to ask a question just so we can start it off. Firstly, let me welcome everybody here again this afternoon. I want to crack joke, because we know we have crack joke here. Who is Vicilicious? Vic? I don't know. Thank you for coming. I like that name. That's actually why I picked it. It's just one name I actually do like. So whoever it is that owns that mic, thank you. I like that.
Hello, everyone.
Oh, it's you that is Vicilicious.
Vicky.
You see now. You see how I just corner people one at a time. Thank you. Okay, so the first question I'm going to ask, and one of the things that has come out in the last few days, and it may have to go to Dr. Ella direct for the first one, is to do with people in Nigeria, or rather, a lot of diagnosis that has come through this platform, of people who have cancer or going through cancer treatment at the minute, is the statement about everybody seems to be having bone referral to bone cancer. I don't know what that is. and the fact that there's only one machine. I'm not sure how factual that is, but it's not. We don't really want people reporting things that are not exactly facts. So, Dr. Ella, can you help us on this, and can you help us channel people to the right place where they can? We don't advertise any organization. We don't campaign for any organization. Anywhere they can get help is where we want them to be able to access. Thank you. Dr. Ella, are you there?
Okay. I don't know. Yes, can you hear me?
Yes, we can.
Okay. So I don't know if the person means bone scan. So if it's bone scan that the individual is asking about, yes, there are just 2 centers in Nigeria where you can do bone scan. One of them is the National Hospital Abuja, and the second one is in University College Hospital in Ibadan. So, but with the lockdown, it's caused a lot of problems because the radiopharmaceutical has to be brought in from South Africa or even France, and with no flights, they were not able to bring any in. So yes, there've been challenges. National Hospital, we haven't even resumed, but 2 weeks ago, the University College Hospital, Ibadan, have started taking patients. So the bone scan is used for staging patients with, depending on the type of cancer that the patient has, and you might need a bone scan to adequately stage the disease. So if it's about patients coming with a lot of bone involvement, well, if you look at it, the commonest female cancer being breast cancer is one of the bone-loving cancers. And if it's prostate cancer in men, which is the commonest, it's also a very bone-loving cancer. So when patients don't present early, there's a tendency for, a large percentage of patients who are coming with prostate cancer to already have bone involvement at presentation. So it's one of the reasons why we keep on talking about early detection and presenting early, when instead of a patient coming to you on a wheelchair because he already has spinal cord compression at first presentation. So that might be the reason why there's a lot of patients coming with bone involvement. So we just need to let people know to come up early. If you catch it early, then this might reduce the need. But for the bone scan, it's something Nigeria has to just work on. We need more centers. We need it to be all readily available so that things can be a lot easier for these patients. Thank you.
Please let me just ask you one question. Is that PET machine? PET scan?
No. So a bone scan
one.
is like a PET scan, but it looks at only the bones.
Oh.
Unlike a PET scan that looks at both the bone and the soft tissue. So that's what we have available. There's no PET scan in West Africa. So
wow.
We're making do with, yes, we're available. All my patients have to go somewhere else to have their PET CT scans done.
Hence the use of the bone scan. Okay. Thank you,
Yes.
Dr. Ella, for that fantastic message. Gosh, my people perish due to lack of knowledge. Wow. Okay. We need to start looking at how to raise some money for this machine. I'd like to welcome one particular person, Dr. Gbenga. He's in from America. He's one of our resident doctors in the house as well, whenever he can access us. Docky, I know that that's not what you wanted to hear this morning, but thank you very much for joining us from America. With your time difference, we really do appreciate you. Now, the next question I'm coming on to is to Doyin. Doyin, please. On the mental health, now next month is Mental Health Month. And we do know that the mental health of a cancer patient can determine the ability to fight, right? To fight at least to try and give themselves a chance, right? Now, based on people that come in contact, because we have the clinical psychologists, right? There are also people that work on mental health. How how do people access this, and where would they access it in the context of not just England, but factually anywhere? What are the signs people need to look out for to be able to know that I do have cancer, but I am actually sinking? What do I need to do?
I think it's a very relevant question, because obviously if it's in the UK, you go through your GP, or you can access the psychiatric services directly in any A&E or any general hospital. They have a psychiatrist on duty, or at least a psychiatric nurse, so you will get access to psychiatric care. If it's in Nigeria, most doctors will know a psychiatrist that a person can be referred to. Otherwise, all the teaching hospitals and all the general hospitals have psychiatrists. More importantly, what signs to look out for? If a person has a change in mood, or is low in mood, is not sleeping properly, has poor sleep, waking up at odd times, or has broken sleep, or finding it difficult to go to sleep, or waking up very early, much earlier than they normally would, or has poor concentration, these are basic symptoms, or is feeling suicidal. These are basic symptoms that would point to a depressive illness. So this is one of the diagnoses that a psychiatrist would treat. Another is anxiety. For anxiety, the symptoms are actually very similar to depression, but sometimes the person might feel on edge, or might be sweaty, get sweaty palms, or tension, headache, or a few extra symptoms basically. And lack of motivation, or lack of energy, feeling tired all the time, not really interested in life, not enjoying anything. These are symptoms you get in depression that one can look out for. So sometimes the person is himself or herself is too low in mood to even recognize it in themselves. But if relatives or friends around them notice this change in their symptoms or change in their behavior or personality, they can actually help support them in getting a referral to the appropriate doctor.
Thank you. Now, who do I want to corner now? Our resident doctor. No, I'll come back, because that one, resident doctor is resident doctor. Biola. Now, I'm going to Biola for a reason. One of the things I have found, and I think it's very important that we all recognize where we are coming from. One of the things I have found going through the journey was when I got diagnosed and I had treatments, sometimes the side effects were not always clear to me. And I luckily had the opportunity to have Biola to access, to be able to ask questions like, what do I do? What do I take? This thing is paining me. This is because, like I say to people, the journey, the pains we go through are quite hard. Biola, from your view, what are the main pains that we expect, and how do we go forward with making sure we're accessing with the right questions? I'll give you why I say that. For instance, in January, when my feet reacted to Kadcyla and I could barely walk. Now, that was something that I had to call you about, because I took that pregabalin that nearly knocked me out and made me think that I was in a bad place. But before that, I had blistered my entire feet. So, but not blistered it. What would you say? How would we move forward with this one? If you have any questions, please, can you just send a question? I will put it. I've got a question I will come back to. So let's go. Yola, thank you.
So generally, with chemotherapy treatment or immunotherapy, there are certain side effects that patients are counseled on, mainly diarrhea, nausea and vomiting, constipation. In some cases where patients are getting maybe radiotherapy or stuff like that, they can expect things like bone pain or joint pain. Some side effects could cause like bleeding or bruising and stuff like that. So basically what here, what we do is we have guidelines, basically, that there are protocols and guidelines that are put together listing each type of treatment and what the side effects are. And what they try to do here is they try to counter those side effects by giving medication. So for instance, with nausea and vomiting, you will find that with most chemotherapy regimens, they would probably prescribe steroids for maybe like 3 days after chemotherapy. That is to help, depending again on the how bad they expect the nausea and vomiting to be with the treatment. They also prescribe laxatives for constipation. They will also prescribe like painkillers as well if they expect that the patient will have pain. Those are general side effects that you would expect the patient to have. But there are also obviously some side effects like you experience, Auntie, that are not general, that come with the type of treatment you're on. I mean, the main thing that I can suggest is that, you know, there's always the pharmacist to speak to about these things, or you can always get at hospital, depending on where you are, especially in this country, you can always get to speak to the pharmacist to explain to them that these are the side effects you are experiencing, and they can advise you on what you can do to help reduce those. But generally, there are medications that come as a package with your treatment that you're supposed to take to help reduce these side effects. I don't know if that's...
Yes, thank you. We know we don't have one size fits all. There's a question here, and thank you. I'm actually going to take this question direct to Ebon for a reason. It says, how can one use diet to prevent or manage cancer? Is that go on. I know this is a controversial question. I know that, because there are very many views on diets and no diets, but at least we can still have a chat.
Yeah. Yeah, thank you very much, Denise. I'm not sure I'm the best person. We have some.
No, we have other people on the panel.
Yeah,
so people can please support you, doctors.
Yeah, we have some people that are so health conscious. They know.
Dr. Wenga, you're also here. So please, when you can help.
They know what is in every vegetable and whatever out there. What has happened is that we are in an information age, and a lot of research has been done. People that are interested in the regular medications, people that, you know, have gone the way of the herbal medications, and, you know, people that just do natural stuff. So a lot of information is out there. In terms of the legitimacy of some of this information, I'm not the best person to comment. I am aware that certain foods, that eating right helps, but from the research point of view, I'm not aware of a direct correlation between specific foods, and I'm talking generally now, specific foods and specific cancers. Over the years, people have talked about avoiding dairy products. People have talked about avoiding certain things, but most of what I talk about is about just maintaining moderation and listening to your body, because in some of the things you have online, some of the foods that they say that help certain people are actually foods that predispose certain people to cancers. So understand your body. And in terms of prevention, something that Dr. Ella has mentioned earlier on is early detection. So taking note of those early changes, understand your body. If it's the breast, understand how your breast is, so that if there is a lump, you know, it's easily detected, and then you can seek help. If it's your bowels and you notice that there's a change in your bowel function, in your bowel movements, some people go to the toilet every week. That's a long time for some of the people. Some empty their bowels, or they poo-poo, as we say, every day. For some, it's every day. They wake up in the morning, they have a glass of water, and they go to the toilet. So when you see that there is a change, pay attention. Some people go from being very constipated to being very loose, having diarrheal stools. So don't just don't just wish it away. Pay attention. If it's cough, if it's breathlessness, if it's if there's something that hasn't been, if you've stopped your menstruation, for ladies that are that age, and then all of a sudden you find out that that you're having the vaginal bleed again, and it's coming out more than before, or it's brownish, it's smelly, pay attention to these little changes, because like Denise described on the very first session, some of these subtle changes are things that actually show that something is wrong. I'll stop there, and then I'll allow the nutrition experts to make comments. There's lots of things out there, and vitamins and supplements, all of which have been said to help prevent or help with cancer treatment. I'll stop there.
Is there a nutrition help person online? Dr. Ella, I know you have a view on this matter with food.
Yes, sorry? And Benga gave us some comments once in the past, so he might know one or two things. Thank you.
Lucky, he knows.
Yeah, so I'd have loved to turn on my video, but I'm on a walk, and it's pretty noisy. But in terms of nutrition, what I can say, I remember when I was at Jefferson University Hospital in Philadelphia, they started a department called Complementary and Alternative Medicine. It's a big department that was started, and a lot of the psychiatrists actually had to start the department. So what they do, which is almost similar what Dr. Ebun had mentioned, where you can use herbs, and in pharmacy you call that pharmacognosy. So a lot of medications really are from herbs, like a lot of medications from herbs, and the Asians have mastered that art. And in Nigeria we use what they call agbo. Some of these things work, but one doesn't know, what they actually contain. So here in the US, what they do, you have a lot of cancer places that actually use nutrition as part of their regimen to treat patients. I'm not an expert in that, but I know that when patients have cancer, their diet regimen is a big part of the whole treatment. So that's all I have to say.
Any other person having any contributions to this? Any questions on this? No? Okay. One of the things I will say on this, from the perspective of somebody that has to go through this, is we have to also recognize this hear your body. Please hear your body. I'm going to state that thing. Please hear your body. Some people do not now eat, saying they can't eat this, they can't eat that when they are taking chemo. Then they are losing all the fat and the weight and everything they're going to use to fight, and there's nothing left there for them to use. Please, we to hear your body. That's my own understanding. I'm not a medical person. I went through chemo quite differently from my mom, but the truth about it, I learned healthy. I'm not going to lie. I learned to drink ugu juice. I learned to drink those things, but I learned it because I needed the supplements to not allow me take the medicines. You see, some of these things, there's medicine. So if you need blood, you go and take blood medicine. No. You can drink ugu as well. So it does complement. There are some things that we all know help. If you've got a cold, drink your ginger and your lemon. Yes, that helps because of the fact that I was already taking chemo. So there's a difference. It's because of that. So where I can reduce and use natural, I use natural. But I do not supplement and say don't do chemo, just go and take natural. I don't know about that one. So let us keep going. Another one, Viola, do you have any comment before I move on? Doing, do you have any comment?
No.
No, I just I agree with what you've said. A healthy diet is very important when you're undergoing cancer treatment, basically because we know that the chemotherapy targets every cell in the body. So it's not just targeting the cancer cells, it's also targeting the healthy cells as well. And if the body is not well nutrition to, as Auntie said, fight back, then it's more or less a losing battle. The patients that I dealt with from a nutritional point of view were kids who could not eat, basically because they were undergoing chemotherapy, and it was a big deal. I mean, we always had a dietitian on board because they had to make sure that, your nutrition doesn't just consist of your proteins, your carbohydrates, and that you also have your electrolytes, you have, trace elements. There's so many things that, go into maintaining a healthy nutritional state. So from an IV nutrition point of view, we had to make sure that, first of all, you have to make sure that you're not overfeeding the cancer patient, because that could also go the wrong way, and you're not underfeeding them, and you're also supplementing them as much as possible. So it's just to basically, not to say that, some foods you can eat and some foods you cannot eat, but to also make sure that maybe get a dietitian's inputs, and try to see what works for you, listening to your body, like people have said here. And yes, there are also herbal things that, you can use that generally are good for the body and do not, as long as they don't interact or have any adverse effects in the body based on your treatment, then it's good. That would be what I would say.
Okay. Anybody with question anybody will have the question they want to ask if I continue again? If you have a question,
Also, I
please
just want to make
put
a
up your hand
comment.
and just say, we're not following. I'm trying to look at what the...
Just want to comment on this.
Okay, Dr. Ella, go on.
So I tell my patients it's important to actually eat a balanced diet. A healthy balanced diet is better than saying, because a lot of them, there's a lot of wrong information available. Patients are hearing, the cancer cells feeds on sugars and carbohydrates, and they cut it off completely from, their diets. They go on fruits and veggies only. Some even cut away all protein. It's one part of our cancer care that no matter how much we try to give information, there's always counter information coming to the patient. So I always preach to them, first of all, not at the time when you're taking chemo. The nutritional needs of your body at that time is not something that, not having all the nutrients you require to produce your blood cells would just make you anemic. You'll need to start having blood transfusions. And these are things that you can easily avoid by just eating a balanced diet. So we try our best, but there's so much. You hear people, they come to you, I've changed, I'm doing Hallelujah diet, I'm on only fruits, completely. And by the second course, they're coming to you with low blood levels, low white cells. You have so much to do to be able to help them continue their treatment. So we need to still keep putting out the right words. Some patients will stop treatment and say, the head SARS-UP is 10,000 times better than chemo. So we need to find a way to always pass the right information. But I know because of the number of patients in Nigeria, most doctors, or we don't even have the time. The dietitians are not enough for you to say, we need a nutritionist to come in. They used to come to the clinic, but everybody's not there at the same time. So some people get the information, and then the others just get wrong information from somewhere else. And then again, about like Abiola mentioned, you do not know the interaction that can happen. You don't know if what you're using is going to, have an interaction with your chemo drug. So it's best for you to just eat
a balanced diet while you're on treatment. And then even the supplements, I tell them I don't know about, because there's so much information, there's so much. They'll tell you this supplement can cure cancer, diabetes, hypertension, everything. One supplement to do all of that, and you don't even know what it contains. So you just need to keep spreading the word for people. Please, just eat a healthy diet. That's what we require. Thank you.
Thank you. There's a comment here that is key, and I'm going to take this back to you, Doyin. It's to do with the hair loss that affects a lot of us that at one point or the other have been through the cancer journey. I can say for me, because I always had long hair, I took charge and I scraped the hair before the hair started falling out. More because I knew that if I started to watch the hair falling out, I may have gone into severe depression. So instead of that, it's better to not have the hair. So I'm not even going to cry about the hair. So by the time I went the first week and I saw the thing was already looking like it wants to get sick, I offloaded the whole thing and I carried a new fashion look. But to be honest with you, it is a very big thing for especially women. How do people, or what do you see as strategies that can balance this because it happens, balance people to think about other parts of the whole thing? My own was just scrape it, but maybe I know that in the Cancer Center for Breast Cancer they have this hat now. They have what they call a cooling hat. I tried the cooling hat. The pain was more than the problem, so it wasn't going to work. Over to you. Thank you. Any questions, please? I'm still taking questions. We've got about 15 minutes and that's it.
I think for different people, loss of hair would mean different things. For some people, it might mean the world to them. Some people don't care about their hair. It depends on their self-image, their self-esteem. So a lot of it goes into what it means to the individual. I think one of the problems with losing hair is, one, there's the individual issue, but two, I think the people around, how they react to the hair loss is important as well. If they're positive about it and say, well, it's a temporary thing, you can wear a wig and things like that. I know someone that lost his hair from cancer treatment, and when the hair grew back, it actually grew back very silky, lovely hair. So he was actually pleased that he had lost his old, thick or whatever type of hair. But I think basic counseling is probably one of the main approaches if it becomes a major issue. And help them think positive. The people around, don't keep commenting, what have you done with your hair? What's happened to your hair? Sometimes we can be very nasty to each other without knowing it. The way we talk to each other, and in a very not a sensitive way. So I think we need to be nice to each other. If someone loses their hair for whatever reason, it might not even be due to treatments. People lose their hair with alopecia. Stress, anxiety can cause hair loss and other things. And if someone is already feeling bad about their hair loss, and then someone comes along and starts making nasty comments, or it just makes them feel even worse. And it can actually get to the point that the person can start to feel very depressed and very suicidal. So we actually need to be careful how sensitive issues are handled.
Okay, now I'm going to come off on it.
Yeah. Okay. Sorry, just to add to the body image. I'm sorry, Dennis.
Yeah, go on.
Yeah, it's to add to what Doyin has said. There are times when it's not just the hair. There are times when people put on weight because of the steroids. And unfortunately, some people have to be on high dose steroids for a long time. And we have to be sensitive. And there are times when we genuinely don't know that that this has been as a result of treatment, because as women, we sometimes try to be each other's keeper, and you're like, Ebo, how come you've put on so much weight and all of that, and you don't know that I am actually struggling with the fact that I'm having some treatment and my weight is going up, and it's not exactly my fault. It's not because I'm eating too much. I think because we're on a forum with different people, we should be kind to ourselves. If we have those type of comments and people are not aware, we should be kind to ourselves, and not go under. And if we have said such things to people and that have made them feel bad, we should actually, get back and try to mend fences. One of the beautiful things about this forum is that it's been so real, and people have been very real, and there's been very positive outcomes. Also with the vomiting, there are times when with the vomiting, people are vomiting and they're completely out of control, and it's almost a public thing. There must be ways by which we are kind to ourselves, and there might be some faith people on the forum today. I would say that we should try to be kind to ourselves. I like the fact that Doyin stressed that, so I thought I'm going to talk about that as well. The fact that you're a pastor or you're an imam or whatever the faith is, you should add some kindness and some sensitivity to some of the advice that you're giving. Thank you.
Thank you. Thank you, Ebun, because I was about to say that when I did my first steroid, my head was like this. Actually, I won't tell you, it was my biggest risk of depression because I, at a point, couldn't carry my head. And that really, really got to me. So the neck had come out further up the side, and it goes down. Apparently, they did say it will go down, and it is going down, but it's 4 years, and it's still going down. So for that one, I know that we always think that we don't look very good. We don't look good, but where there's life, there's hope. So my fellow people on the platform, where there's life, there's hope. Let's continue to fight this fight. Is there any other question? Because I'm trying to go through all these now. Body image. Doc Benga, I have seen the message. I've saved it. I'm going to tell them to share it on the Common Cancer Instagram page, what you have added onto it. So that
was the question Dr. Ebun had asked about oncology pharmacist or so. So I just found that link and I wanted to share it.
Yes, thank you. No, but we'll put it on just so that people can also access this as well. Do we have access to oncology pharmacologists in Nigeria? Dr. Ella, can you help us on this one, please? And then I have one question, one hand up.
Okay, so yes, we.
I've seen your hand.
It's a new area. So, but yes, we do have. In my hospital, we have oncology pharmacists who assist with the compounding of the drugs, mixing, but it's new. When I started my training, we didn't have them, and then we have them available now. But I don't think they're everywhere, so it's evolving.
So that one is Abuja. Dr. Ella is based in Abuja. I don't know. Maybe we'll find somebody else in Lagos that's ready to come on. Moise, you have the floor now. I've lowered your hand. Go on.
Hi, sorry, it's not actually Moise.
Welcome, Moise. David.
Yes, David. Sorry, I'm just going to be quickly brief to the point. It's more relevant to the discussion around mental issues, mental health, state of mind. Somebody mentioned that earlier on. The only thing I would say is, going through this, the whole cancer process, you cannot rule out the importance of one's mental health, and that's not just about the patient as well, but that's about your support units. So there are two things. You look at denial and acceptance. In terms of the patients going through denial and acceptance process, but there's also those who your support unit. It's easy to actually have people who you need to surround yourself with positive people, but in terms of positivity is not in terms of accepting everything that you want them to accept, but staying positive, because the patient is going through a lot of difficulty, difficult questions, difficult answers, difficult things they're going to have to resolve. So having positive people around you, you need to ensure who you actually have around you as your support unit. So it's not just about going with people who are just going to go with what you want them to go with, but going with people who, at times, they would challenge you in your decision that you're making, to try and get you back, realign you back into the right your mental state. Because the cancer patient has got a lot of things going through their heads. So for me, I can't stress the importance of the mental side of things and the issue to do with denial and acceptance. That's the only thing I'm going to add on that one. Thank you.
Thank you, David. Thank you. Staying positive. Okay. I have a question here. For this weight gain, how can one control it? Because it's really becoming an issue for me, as I feel very heavy and bloated all the time. I'm going to try and answer this one more because I actually live with the case with this, and I believe I'm speaking to somebody who's going through the treatment. So let's talk to ourselves. That's weight gain. Nothing. Just eat the food, because if you don't eat food, you cannot fight the sickness. You cannot take the drugs and make sure the drugs work. As far as bloating is concerned, I did know that from my perspective, and I still have it. I had serious effects of the drugs and ended up quite sick, but they gave me a drug called omeprazole, which lansoprazole, one of the two, Zozol. And one of the things I did find is I didn't understand the rule of taking the drug. So I thought you take it only when you have the pain. I have now, in hindsight, because over 4 years, the pain has gone and come, found that the damage to my that area is not good. And I have to take the drug every day. Now that I've started to take the drug every day, the bloating thing has really subsidized. But I didn't start it. So maybe talk to your doctor and find out about that. But I didn't know that taking that every day was going to be a big thing. Biola, is that correct on this one? Before I go and talk rubbish, because that's the one I know that is happening for me.
Yes, that is correct. Omeprazole and lansoprazole, you can get it over the counter here. I'm sure it's available in Nigeria as well. It does help with reducing the amount of acid that your stomach produces, because when there's excess acid in the stomach, the bloating happens. Other things you can do basically is to maybe just try and eat very slowly, drink slowly, avoid things that will just make your tummy bloat, like chewing gum. Exercise also could help, maybe take walks, because that will help, move, help your digestive system get moving and reduce the bloating as well. Avoid things that are gassy. So maybe avoid eating things like beans too much, or drinking Coke and, carbonated drinks. That can help. So these are just little things that you can do alongside taking things like a medication like omeprazole or lansoprazole. There's also ranitidine sometimes that, the patient, if depending on the patient, they might prescribe ranitidine. But these are things that will help generally to reduce the bloating. In terms of the weight gain, like you said, Auntie, that is based on the fact that, it's a side effect of a drug that you're taking. You can't really avoid that. But again, things like exercise, just basically doing the minor things, lifestyle changes basically that can help control the weight will also be helpful.
Thank you. There is a comment that I'm going to be very mindful of. What I'm going to say, it's to do with the use of cannabis as a painkiller. Doyin and Dr. Ella, can you help us here? We're going to be rounding up very shortly. Questions are coming in, but Doyin and Dr. Ella, help us here, because I don't know what the laws are in Nigeria on the cannabis part for the painkiller. But Ebu, you yourself know about this thing now. Okay, you guys help us here. Oh yeah, all of you.
I was because
starting from you. Let's go
yeah,
this way.
because of Doyin's area of interest, I thought you should say something first.
We don't prescribe cannabis for pain or for cancer or anything. So I'll let someone else speak. Then I'll speak last, probably about this cannabis use, because I have, experience of what can happen to people that use cannabis.
Okay, Dr. Ella, can I ask a question on this question? Is this something that's even considered in Nigeria? You see, let's not go off tangent easily.
Not at all. It's not considered because it's not legal in Nigeria. But what I find is a lot of people now start using cannabinoid oil. Okay, so there's a lot of CBD in the market, which are derivatives, I think, from the cannabis, and a lot of people are using it while on treatment. And some people swear by it, but I don't think cannabis itself being prescribed in Nigeria, not yet. We're not there yet.
Okay, thank you. You see, Ebu.
The cannabis oil, it is increasingly popular, and I think it's because of the media around it, especially on the internet. To the best of my knowledge, there is no evidence-based whatever when it comes to the variety of cancers that we see. And usually we just say that people should be careful, especially because these derivatives, they tend to be very expensive. But then when you think about it from the human point of view, when people have been told by their oncologists that they don't have any more options, that the hospital doesn't have more options to offer them, you can't really stop them from looking for, from clutching for something that, that provides hope. So I'm usually very, what I don't know, I don't comment too much on, but I just give some caution that, talk to your pharmacist and just be careful. Thank you.
Okay, Doyin, you can round off for us on this one, right? I've got one more question before we end.
I wouldn't encourage anyone to use anything that contains cannabis because of the side effects I have experienced in my clinical practice. A person can become psychotic having used cannabis. So it's no good going from one problem to another. And we have had patients on the ward who have claimed to have used these cannabis-containing substances to treat either pain or cancer, whatever. They then become very depressed or psychotic, and they end up on the ward with a completely different problem. And there's also the legal aspect. You can end up with the police. So I wouldn't prescribe that. I wouldn't encourage it. But as we said earlier on, if someone chooses to go and do that, then, well, we can't really stop them, whatever they choose to do in their homes, but it's not something that would be encouraged.
Okay, thank you. The last question is about losing weight. Losing weight. The question is very specific. How do you deal with weight loss? Biola, please close for us on this one before I go to the rounding statement.
I don't think there is a prescribed way to deal with weight loss. It could be, weight loss could be for various reasons. It could be as a result of progressive disease. It could be as a result of insufficient diet or malnutrition. In terms of losing weight, sometimes it can also be a reaction to the treatment itself. But as we mentioned earlier, the only way to actually deal with that is to actually make sure that you're eating a balanced diet. As long as there is a balanced diet, as long as the nutrition is fine, then it helps your body to, as we mentioned earlier on, to deal with what your body is going through at the time. apart from that, I don't think there is any other, I can't think of any other way to help that. Weight loss is expected in cancer patients. I mean, when our patients come in for treatment, we take their weight all the time just to see if there have been any major changes in their weight, because that would determine how their treatment goes. But generally, the doctors that I know, what they do is just basically encourage people to eat well, to make sure that, you know, they are doing things that help keep a healthy lifestyle, basically. So that's, I don't know if any of the doctors have any other thing to say, but from my perspective, that is all I can say.
Okay, thank you. I want to just round this all up. For all those who are new on the platform, my name is Denise, and I have lived and I've been battling with this so-called disease as a survivor now, is what I've been told. So whatever they call it, it don't really matter. Is the word is still cancer. Cancer is not the C word, it's cancer. Looking at all the challenges we face as patients on this journey, we all will take the challenges very differently. But one thing I do know, and I've picked up across the way, especially when we talk about this weight loss, whatever you can eat, just eat it. There's no need for us to perambulate. If you can only eat ice cream, just eat it. It has milk in it. Please. Because if you don't have any fat in your body, there's nothing going to help you to fight to take the medicine. Then we all get sick. So I hear all these people, but I learned it. My mom was told, just eat. Me, I didn't do just eat. However, whenever I take my Katsila today, if I need to eat ice cream, I eat my ice cream, because sometimes I don't feel like eating food. And I know that I have to eat something. So for all of us that are on this platform, that are going through this journey, it is not an easy journey. I recognize it. We are all together on it. We've got professionals on board who are with us. And to all those who are supporting us that are on it, I want to take this opportunity to say thank you. As family, we appreciate you. We know you also go through this journey emotionally, mentally, physically. You go with us to hospital, you are crying in the corner. We know. The truth is that we are not saying anything because we don't know what to say to you, because we don't even understand what's going on with us. However, we want to say thank you. So to all our carers on the platform, I give you a thank you from all of us that are going through it. Thank you for being a source of support to us. To the medical practitioners who are online and those who have always been with us, we want to say thank you also for being with us, for just listening to us, just talking with us, just making sure that we have a support network that works for us. Next session is going to be cancer and our mental health. And that one we have got a society doctor, clinical oncologist, and we've got well-being, Dr. Winga, also speaking from their perspective and explaining to us. So it's another question interactive session like this. And any questions, send them. If you send them in, we'll take them. If you register on time, please share the links, share the information once it starts going out. And on behalf of all the members, support group that has encouraged us, I can tell you it's not been easy, but the encouragement I keep getting from a lot of people to continue this is quite, I am really blessed, and I hope that we will be a blessing to each other. To all of us that are on this platform, please, for your brothers, your sisters, family, friends who are going through cancer, let us fight it together. Together, we can fight. Singly, it is very hard. And our parents or people that are loving us do not understand what we are going through. So if we talk about it, we help other people. If we share our experiences, we are a source of support to other people out there. If we know of routes or guidance that is available to other people anywhere in the world, please just share with them. Common Cancer Foundation can be found. We have an Instagram page. We have a Facebook page. Our website is still under construction. And to be honest with you, it's because I haven't been able to finish a lot of papers that they've asked me to submit. Outside of that, I want to say thank you. For those of us that don't remember, there is God. That's all I hold on to, is the one that helps us. Your mental health being, your everything. I'm not saying whether you're Christian or Muslim, there is God. Look up to him. He's the only one that can solve this. The practitioners can only help us, direct us, and hold our hands. Our families love us, and they are caring for us, and we appreciate them. But please remember that none of us can walk this journey on our own. Somebody up there is still looking out for us. I want to thank everybody for joining us this afternoon. Thank you for coming on to Commode Cancer Foundation. We hope that we'll see you soon. Our next one is on the 10th of the 10th, which also happens to be my late mother's birthday. And that happens to be Mental Health Day. So you see, it's very selective. Mental Health Day is a Saturday. I look forward to seeing you all there again on that day. Thank you for joining. Thank you for coming on.